Today I'm going to discuss the pectoral region fascia. So first of all, what are the various layers of pectoral region that we go through if we dissect from the surface or the skin? First of all, we'll encounter skin. When we remove the skin, we'll see the superficial fascia. After that, there will be deep fascia, and in case of pectoral region, it will be the pectoral fascia. Then is the pectoralis major muscle. When we remove the pectoralis major muscle, there will be clavipectoral fascia. Then will be pectoralis minor muscle, the subclavius, and the serratus anterior muscle. These are the four muscles of the pectoral region: the pec major, pec minor, subclavius, and the serratus anterior. In this picture, we can very clearly see on the left side there is fascia which hasn't been removed, and on this side the fascia has been removed, and we can see the muscles of the pectoral region. These yellowish structures are the cutaneous nerves. What is fascia exactly? Fascia is a thin casing of connective tissue that surrounds various organs, blood vessels, bone, nerve fiber, and muscles in place. The superficial fascia of the pectoral region has various cutaneous nerves, cutaneous vessels, platysma, which is a muscle, the breast, and moderate amount of fat. In this picture, we can see the structures, various structures that we have enumerated in the previous slide. The cutaneous nerves are the supraclavicular nerves. These are three in number: the medial supraclavicular nerve, the intermediate supraclavicular nerve, and the lateral supraclavicular nerve. And these are coming from the cervical plexus. The root value of supraclavicular nerves is C3 and C4. And these nerves supply the area of the clavicle up to the second rib here. Then are the anterior and lateral cutaneous branches of the intercostal nerves, these four. The anterior ones supply the middle of the chest, and the lateral, they go towards the lateral side. These are branches of intercostal nerves. They are in the region of the rib 2 to rib 6. Then we have the intercostobrachial nerve here, which is the root value of T2, intercostobrachial nerve is T2. As I've told you in the previous picture, we have the supraclavicular nerves having root value of C3 and C4. Then we have the anterior and lateral cutaneous branches of the second to sixth intercostal nerves. And then we have the intercostobrachial nerve T2, which supplies the area of axilla and the upper part of the medial side of arm. Now coming to platysma. What is platysma? Platysma is a subcutaneous muscle. It is a thin broad sheet of subcutaneous muscle. Its fibers arise from the fascia which is covering the pectoralis major muscle here. So the pectoral fascia is the origin of platysma, and it is inserted here above at the level of the base of mandible and skin of face. So the direction of movement of fibers of platysma is medially and upwards, as you can see in this picture. The origin is from the pectoral fascia. It goes up and medially, and it is inserted into base of the mandible at the level of the lower part of face. The nerve supply of platysma is the facial nerve, and the function of platysma is that here it protects the external jugular vein from external pressure. Now coming to clavipectoral fascia, this is one of the deep fascias of the pectoral region. The clavipectoral fascia is is at the level of clavicle. It starts at the level of clavicle. Above the clavicle, it becomes continuous with the investing layer of deep cervical fascia. This picture very briefly summarizes the main features of clavipectoral fascia. So the above this structure is clavicle. The clavipectoral fascia has attachment on all sides of the subclavian groove. Subclavian groove gives attachment to the subclavius muscle. So the clavipectoral fascia splits into two and encloses the subclavius muscle. It goes down as a single layer, which is called the costocoracoid membrane, this area. Then it's again splits into two to enclose the pectoralis minor muscle. Then again the two laminae fuse, and here it is called the suspensory ligament of axilla. And as we go further down, it becomes continuous with the axillary fascia. So the location of clavipectoral fascia is basically beneath the pectoralis major muscle. This is pectoralis major muscle. The pectoral fascia is lying beneath the pectoralis major muscle. So it encloses two muscles, the subclavius above and the pectoralis minor muscle. The area of clavipectoral fascia between subclavius and pectoralis minor muscle is called the costocoracoid membrane here, and the area between the subclavius muscle and where it becomes continuous with the axillary fascia is called the suspensory ligament of axilla. In this picture, we can see this is clavicle and this is the entire extent of the clavipectoral fascia. This picture is from the side. We are looking at the cross section of the clavipectoral fascia. And in this picture, we are seeing the clavipectoral fascia from the front. So here, this is clavicle, the upper extent of clavipectoral fascia. It goes down till this is the pectoralis minor muscle, and then it further goes down and becomes continuous with the axillary fascia here. Medially, clavipectoral fascia is attached to the external oblique muscle, and laterally it is attached to the coracoid process of scapula. This picture shows the clavipectoral fascia and the structures which are piercing it. The thoracoacromial artery, the cephalic vein, and in addition to these, we have the lateral pectoral nerve and various lymphatics. So these four structures are piercing the clavipectoral fascia. The four structures are lateral pectoral nerve and thoracoacromial artery. They pierce the clavipectoral fascia from inside to outside, and the cephalic vein and the lymphatics, they go from outside to inside. So this is all about the clavipectoral fascia. Thank you.